Steve, the Concord Coalition has long been associated with means testing. We had a means testing proposal way back in the early 90s. And so why don't we begin by just talking about what is the concept of means testing? Is it generally used in the federal budget? And what is the overall effect?
Yeah, I mean, means testing has, some great political appeal. I mean, the idea or the argument that you often hear is, people like Warren Buffett, they have millions and billions of dollars, and clearly they don't need their Social Security and Medicare benefits to survive. And so the idea would be that, you could reduce benefits for the rich because they don't need them, and the government would save the money, and they could either reduce the deficit or they could use the savings to pay for benefits for other people. So, I mean, the concept of means testing presented as a political matter is sort of it's sort of the flip side of tax the rich. The argument is the rich have lots of money, let's tax them because they can afford it. And the same thing on the benefit side is that the rich have lots of money, therefore they don't need their federal benefits. But traditionally, means testing actually has had a slightly different meaning. I mean, obviously, welfare programs like the SSI program, food stamps, Medicaid, those programs are means tested, which means that the government provides certain federal benefits to low-income individuals. And as your income rises, those benefits are phased out or eliminated. And so that's a way to control the cost of the programs on the low end. And so, what Concord had proposed many years ago, and what I write about in my latest issue brief, is sort of the taking the means testing concept from the welfare side of the equation and applying it at the higher end of the equation to say, well, we could, just like we phase out benefits for low-income folks in the case of welfare programs, in the case of broader social insurance programs like Medicare and Social Security, the idea would be that you would reduce benefits at the upper end. And you would obviously achieve some savings, but one of the conclusions of my paper is that you don't save nearly as much as you might have thought.